Hello and welcome to this video. I'm going to be talking about pain reprocessing therapy. So it's one of the tools that I use in treating and working with my clients that have pain, persistent pain mainly, because pain reprocessing therapy has to do with what's called neuroplastic pain. And one of the easiest ways to kind of explain what neuroplastic pain is it's a sensation plus fear, and that usually equals that pain. Okay, it's that idea that the sensation that you're getting from your body gets added to with things that are going on in your brain, whether it's anxiety or stress or fear or overload or pushing through, or there's a whole number of things. Those get added to the sensation. What ends up happening is that your nervous system starts to see more danger than there is. So it creates this experience of what we know as pain. Okay. Pain itself can be something as much as like if I pinch my finger versus like you getting a knife sliced through my hand. Okay. There's different levels of pain, and you've likely all seen that pain scoring sheet where it goes from 1 to 10, and there's the little happy, non-happy faces that go with it. And I've talked in the past about how those pain scores, they're not very relevant when we talk about persistent pain sometimes, because when somebody asks us what our pain score is, we start just feeling for the sensation, which is kind of what the doctor's looking for. But when we're experiencing that persistent pain, we know that mental load that comes on top of it. So your pain score, sensation-wise, may be like a 3 to 5, but the load on top of it creates an 80, okay? Or the tissue damage that is related to the sensation you're getting might not be much, but the sensation that you're getting is still an 80. So there's so many variables. Pain is complex, and pain reprocessing therapy is one of the things that I found within my journey through and in this is that it blends really well with what I was already doing. So the reason I got into it is a book came out in 2021 called The Way Out. It's by Alan Gordon and Alon Ziv. And I read it cover to cover, like within a day, which isn't usual for me because I don't read very much. But it's an easy read, and everything I was reading was putting more pieces of the puzzle together for me. So when I ended up finishing that book, it made me want to learn more about pain reprocessing therapy. So luckily, I started looking into it. I was chatting with some other therapists in Calgary. There are a few social workers that do more of the therapy side of pain reprocessing. And I went and chatted with them and asked them if there would be kind of a need for somebody who combines that type of therapy with the movement aspect that I was doing. Now, kind of the gray area is that when we do critical alignment therapy, that's almost that pain reprocessing therapy. So I always recommend, if you do have persistent pain, that pain reprocessing therapy book. It's called The Way Out. I got it from the library. After I finished reading it, I went out and bought it because I knew I needed to have that book on hand, which I need to check because I'm just thinking I lent it to somebody. So Anyways, with that, I kind of wanted to explain what their system is in terms of treatment, and you'll see the similarities that come into what I have out and what my articles list and the videos that we have and the posts that I put up, all of that stuff. So in terms of pain reprocessing therapy, it comes in when you have neuroplastic pain. Okay, that idea that, like I said at the beginning, that your fear, your stress, your anxiety, your overload, that somehow is playing into how much you're experiencing that sensation in your body. Okay, so with that fear pain cycle, we've talked in the past about how you have pain and it's not going away. And it's really getting frustrating because it's not going away. And then that fear comes in and the fear goes, ooh, oh, yeah, this isn't good. Like something really must be wrong, which is normal. Okay, is totally normal because we have evolved to learn that if there's a physical sensation in our body and it is very uncomfortable, that something must be wrong and we should go figure out how to fix it. Okay, so that's the normal part. What ends up happening with this fear pain cycle is that the fear kicks in, the nervous system goes, oh, that's dangerous. And then we still don't know what to do about it. And we think that we're going to be okay. And then it just keeps going and it kicks in and we try and do something and it doesn't work. And we wait for appointments and we wait for injections and we wait and we try prescriptions and all of this stuff. Okay. And that fear kicks in and the pain gets higher and the pain gets higher. And then you realize the pain's higher. And then there's more fear and it's just that cycle. Okay, so that's kind of where that neuroplastic pain comes from. And unfortunately, within that cycle over the long term, it actually creates stronger nerve pathways to those sensations. So like mine is my lower back. So if I'm starting to get stressed or I'm overloaded doing something schedule wise, which is usually my thing when my bucket is full. I've written an article about that too. If your bucket's full, my nervous system goes, oh no, we need to slow her down. And it sends signals to my back because they're really strong. It's not that they're really strong, like, but they're the ones, they're the used to ones, right? They're the ones that are like, yeah, we know, we start triggering this. She has to slow down. Okay. And that neuroplasticity can also start taking over parts of your brain so that it's stronger. Right? So we lose a little bit of language here and there. We forget a couple things because little bits and pieces of our brain start going, no, I'm going to be in this team because it's going to make her slow down. Anyways, I could go on about that. Then what happens? That neuroplasticity is going to get stronger because we tend to push through those initial signals. And that neuroplasticity, the nervous system goes, no, we need to send a stronger signal, right? All of this builds up. So within pain reprocessing therapy, that's what we're looking for, is that our pain is triggered because of these external cues, that it's an experience of stronger pain because of different triggers. It's usually, and typically when I get referrals from doctors, they have exhausted all of the scanning, all of the surgeries, all of the injections, all of the prescriptions, and people still have their pain. And when that happens, they send people to me because we start looking at the big picture of talking about the education of how that's happened, that it is reversible, but it takes a little bit of work. And when we look at that work, we tend to think, oh, well, it's physiotherapy. I'm going to go get that right exercise. But at the same time, I just talked about how that's not really what is going on. Okay. It's not that we're missing out on a movement, although usually due to pain, we've stopped the movement aspect, but it's this bigger picture we need to look at. So pain reprocessing therapy brings in this bigger picture. Now, with the brain, with this pain reprocessing, what we do is we assess what that neuroplastic aspect is. What is it that's not tissue damage, but something is making the nervous system feel like it's in danger? So that's where we start to do the assessment. And within that, because of my background, I go for the movement and I go for that whole stress, anxiety part of what's going on. We start putting these pieces together. Okay. So in terms of pain reprocessing therapy, it's not the movement aspect. They actually don't really do any movement in the pain reprocessing therapy itself. They look a lot at what's causing the nervous system to feel that danger, that stress, that anxiety, that frustration, that overload. And then we work towards doing the somatic tracking, okay, which is the critical alignment aspect. And when I was starting to blend in my pain science, like everything I was learning through Explain Pain, and the critical alignment aspect of it, and the other books that I've been reading, it just blends so nicely that we can do critical alignment and pay attention to our breath and connect into different body parts to create that sense of safety. With pain reprocessing, it goes that one step further, which is really what I liked about it, is that when we're doing critical alignment, that we take that moment to notice the sensation. We notice it. We try to detach the fear. We try to detach that image that you have in your head. Oh, it's degenerative disc disease. Oh, it's my SI joint being this. It's arthritis. It's osteoarthritis. It's bone density. It's facet joint arthritis. It's compression fractures. It's all those things that we've heard. It's my posture. It's my core. What we do when we're doing that critical alignment therapy, included with the pain reprocessing, if you've done some videos, you're going to start putting two and two together here, is that we're not only connecting the breath to the sensation of the body, okay, and those controlled movements, but we're starting to allow for the breath to bring us into a sensation without analyzing it, so that we can feel a sensation without the fear, without the anxiety, without the stress, without the overload. And we can just notice that sensation. We're like, huh, it's a sensation, okay? All of a sudden, maybe it doesn't feel like it's burning and stabbing as much, or it might, but we're looking at it in a way that's outcome independent. Now, this is a key part of the pain reprocessing therapy, is that when we look at those sensations, we look at them to not change them. Because the tendency is when you do those critical alignment exercises and you lay down on the strap, because you know you're going to probably 99% chance feel better when you get off of that strap, okay? You know that at some point something's going to release, or you're going to be breathing, or you're just going to feel something better. So we take that out and you just pay attention to the sensation and you notice, if it's burning, maybe we can just let it be like that for a while, right? You can hear in my voice that it's like, okay, that's fine. We're just going to let it be. And then the body, the nervous system goes, but wait, it's dangerous. you're not paying attention. You're not freaking out about it. And you're like, no, it's just what it is. And practicing that over time helps to calm the nervous system, okay? And bring whatever the sensation is back to a reasonable level. And one thing they talk about in pain reprocessing therapy is that we're not trying to get rid of our pain, because realistically, we actually need pain to live, okay? Pain is something that keeps us alive. If we didn't have pain sensations, we wouldn't live very long. And there are people who are born genetically that do not feel any pain. And unfortunately, they don't usually live very long because they don't build up that awareness of things that are dangerous for them. Okay. So what we're looking at is creating less stress, less anxiety, less fear around these sensations so that we can move on. Okay, we can continue to build the life that we want and not be controlled by, oh, if I sit in a car for 2 hours, I'm not going to be able to walk for 5 days. Well, that happens a lot because part of the brain says, we shouldn't be sitting. This is bad for us. Okay. And some of the brain goes, well, it hurts to sit. So then it gets to the point where it gets very specific, where it's like, if you sit longer than 12 minutes, I'm going to send you signals, right? And you're like, well, how are you going to drive anywhere? But we're working on calming the nervous system so that it can look at the sensation and be like, okay, I am safe. There's no major damage happening while I'm sitting here. I'm going to take care of it. And even if there is a sensation, it's that idea that, yeah, I can hear you and we're going to take care of it. So it's going to be okay. Like, I know we're going to sit in the car for an extra half an hour, but when we get out, we're going to do some movements that we like, right? And then the nervous system goes, oh, okay, right? Maybe yours does. Mine kind of does. Yeah. Sometimes it just gets really cranky. But that's what we practice with pain reprocessing, because we're working on reprocessing the signals that get sent to trigger that pain. Okay. And with that tracking that we do with critical alignment, it's called somatic tracking, where you're connecting your breath to the sensations of your body, creating safety, creating an awareness without that fear and anxiety, right? Now, like I mentioned, this isn't about getting rid of our pain, all right? In order to get, I don't want to say get rid of, because depending on what's going on with your body, it may just be that every so often when you push too hard, that's going to get triggered, okay? But ideally, what happens when it gets triggered is when you practice that somatic tracking enough, when it does get triggered, your body goes, oh, I get to practice again. Like it's a challenge. It's like a positive challenge now. It's not a, oh no, I'm going to be in bed for 4 days because my back hurts so much. It turns into I know this is temporary. I'm going to practice my breathing. I'm going to look at what might have triggered it. It's probably going to be pretty obvious what triggered it. And you recover faster. And I can tell you from my own experience, last time my back decided to freak out to the point where I could not come off perpendicular at all. And my lovely daughter decided to take a video of me trying to get into bed, which now that I'm talking about it, maybe I'll post that on Instagram tomorrow. But I can laugh about it. And I was honestly laughing about it at the time because I knew what I'd done. I had been overworking and I've been putting a lot of pressure on myself to get certain projects done. And I'd been sitting way too long in one certain position and not listening to how my body wants to move more. So at a certain point, after about a week and a half, it decided to tell me, forget this, we're done. And I could feel it coming on, and I did work to try and ease it, but it was a bit too late at that point. But when it really hit, I knew that it was temporary. And I just kept telling myself, I know this is temporary, and I know what I need to do. I'm just going to go to bed because I'm just going to essentially sleep it off. Took me a while to get into bed. Took me a while to get up the stairs, in fact, as well. But I had that practice, and I knew that I could just let myself know this was temporary. I would be safe. And the next morning when I woke up, I had a bit of stiffness, but it was nowhere near the pain that I was experiencing the night before. I was just walking with a neighbor. Same thing. She gets back pain every so often, and she doesn't have this background, and her back pain, her back felt like it was out for 6 days, because as soon as it happened, she panicked. So with that panic comes in more fear. And she, like she said, she was in bed for 3 days because it was just so much. And I'm not saying that both of our things were exactly the same, but when it comes to something that just kind of triggers, especially back pain, it's a matter of, again, using this as practice to be like, I know this is temporary, okay? And it keeps the nervous system calm. It doesn't re-trigger all of those pathways as much, and you can move on. So that's the biggest thing with pain reprocessing therapy. And it's at a point where it will reduce the intensity of what pain you're experiencing. And it gives you those tools that it essentially gives you tools for 2 things, okay? One is the sensation, like, oh, my back is achy. That, it goes, okay, I want you to pay attention to your breathing. I want you to notice that without any outcome independence, right? You don't need to change it. You just need to notice it calmly. Notice that you're safe. That's level 1, okay? Level 2, because we do have that flare up pain, they tell you, do whatever you need to do to be comfortable. Don't worry about the somatic tracking. Just do that. What you need to, lay down, get the hot water bottle, whatever helps, do it. But know that it is temporary. Okay? Because the path through pain, when we're in that, it's not a straight line. It's never going to be a straight line. Okay. It kind of goes like this, and they're called, and when you end up with your next flare up, it's called like a breakout, right? Where your body is used to responding a certain way, and you've been really good about paying attention and doing things, but you're going to slip up. Nobody's perfect. Okay. Nobody is perfect. And you're going to slip up at some point. You're going to go too much one day. You're going to do something more another day. And your nervous system goes, oh, they did too much. I know how to get their attention really, really fast. And that pain just shoots. And you're like, what happened? Like, I've been doing so well. Now I'm back at the beginning and I'm going to have to start again. But remember, you have to trust the process, know that it isn't a straight line. And when those little things kick in, because they're going to, that's our chance to practice. Okay. So with that being said, that's really essentially the biggest thing about pain reprocessing therapy, is that's how it works into that critical alignment. It's just those couple extra things that I needed to add. So I took the course. And when we're doing those assessments, we just work on gathering evidence that the pain has that neuroplastic side to it, that the the sensations that we're getting, that exhaustion, that fatigue, that frustration, that anxiety that this will never go away, every so often it does. Every so often, like, you'll be reminiscing with a really good friend and everything will be great. And then you're every so often you might go, oh, that didn't hurt. Yeah, every so often you're like just looking for those spots, right? You're looking for that evidence of when does it not hurt. That makes your nervous system go on alert too. So it sounds like a very gray area, and it kind of is sometimes, because everybody is different. Everybody's different. And I just liken it to having a puzzle. Some puzzles for this, there are 100 pieces, and we start fitting those puzzle pieces together, and all of a sudden we've finished the puzzle. Whereas some puzzles are 1,000 pieces and only 2 colors. Okay. So it's a matter of starting to put those puzzle pieces in. And some puzzle pieces you'll be like, yes, this will fit. And if you've done enough puzzles, that it doesn't fit. Or the opposite side of that is, what that puzzle piece is going to look like, and you search and search and search and search for it, and you just can't for the life of you find it. Okay. We need to just step back a little bit, because what happens when you're doing puzzles and those two things are happening. It's a matter of stepping back and going, I'm going to take my mind off this. I'm going to go do something else. And then you can come back to it. Usually, I don't know about your experience, but my experience in puzzles, what that piece looks like. And you come back to it and it was sitting there the entire time. And you were completely sure that this puzzle was missing pieces. Anyways, so that's the basics of pain reprocessing therapy in a nutshell, in terms of how it blends into what we do with critical movement. Okay. So with that being said, if you have any questions, feel free to ask. And I know there's somebody on this call if you want to ask a question. Otherwise, feel free to email me, find your own experience, see where you are with your puzzle, and let me know. We can start putting more pieces together, because it feels good when you get those 10 pieces put together. Funny story. My mom started doing puzzles about 2 years ago. My sister gave her a puzzle. I don't know how this happened, but she was having a really hard time with the puzzle. She didn't know the trick of doing the outside first. So she had just started doing different sections, and she didn't do the border first, which I found was kind of funny. But once she figured that out, her puzzles started coming together way better. Anyways, any questions, please feel free to ask. Otherwise, like I said, by all means, email me, message me, let me know, and I will see you probably in the next video.